So welcome everyone. This is the third QI session that is being run as part of the Modern Ward Round Collaborative. My name is Baxter. I'm an improvement manager with the Emergency Care Improvement Support Team. And this afternoon, it gives me great pleasure to introduce Rebecca Thomas. Becky is a senior nurse for quality improvement at, and I hope I say this right, Morgannwg Health Board. It's been a while since I said anything in Welsh. And in addition to that, Becky's a Bevan exemplar. She's also a member of the Q community, a Fab Wales ambassador, and a 2021 Florence Nightingale scholar. And as some people might have just caught there, Becky's recently founded and hosts a leadership log podcast series. So thanks Becky, thanks for joining us today. So what we plan to do is just have a little bit of a sort of chat, Becky and I, and then we'll open things up for questions. So Becky, I mean, with all those all that stuff around being part of the Q community, Fab ambassador, and obviously the job title, you're involved in a fair bit of quality improvement.
Yeah.
We're coming to the end now of the collaborative, and we've been running the collaborative along the lines of the Institute for Healthcare Improvement and Breakthrough Series methodology. And one of the sort of important parts of that is really about how once you've sort of participated in a collaborative, how do you kind of spread and sustain the gains that you've made. So, I mean, sort of given your involvement in quality improvement, could you tell us a little bit about an improvement that has been successful and sustained and spread that you've been involved in or are aware of?
So firstly, thank you so much for inviting me today. It's a real pleasure. So diolch yn fawr, and I'm coming to you live from Merthyr Tydfil in South Wales, so it's a pleasure to be here. I do feel like you were talking about somebody else when you introduced me, Vince, so I forget really. I think you forget, don't you, some of the stuff that you're involved in. So in terms of an improvement and that success, it depends how you what do you mean by successfully sustained, I guess, isn't it? Because is it sustained for the first 6 months? Are we talking about forever sustained? And so that's some of that quantifiable stuff around. And so I was thinking of a project, and I've gone, probably because it's a project I've just been involved in and kind of just completed as a part of my Scottish Improvement Leaders course, which is equivalent to the IHI's Improvement Advisor course. And it's introducing a virtual visiting service in the organisation, something that we didn't have, and of course something that was born out of the urgency and the chaos that was the COVID pandemic. And so it was something that had already had that kind of senior buy-in behind it, and some of those other things I'm sure we'll talk about when we talk about sustainability. But I did struggle in terms of the spread element of it, because we've got so far with it, and then it's kind of come to a halt now, primarily because of money and because of the devices that are required. So taking us right back, we started the virtual visiting service back last October, so we were a little bit late to the game. We did all the stakeholder analysis, try to understand what the problems were. Essentially what was happening is staff and patients were using their own devices, and so there were some governance issues around that, so that we needed to kind of get on top of that. So we needed a standardised, governance approved approach to virtual visiting in terms of the hardware that we used and the software that we used. So we did lots of work trying to understand what some of the challenges were. We used a Pareto chart to demonstrate to the staff where we would influence our improvement work in the first instance, and it was primarily around lack of devices, something around time, access to the internet, and also then education and training in terms of using devices. And then we agreed on a single platform. So they were using Zoom, they were using FaceTime, sometimes they were using WhatsApp. So there were some governance issues around that, some information governance issues, and we ended up using something called Attend Anywhere. So we started with one ward, one team, in one area, sort of November, December last year, and then gradually we introduced more areas as time went on, and we're currently up to about 42 areas, which is about half, I think, of our inpatient ward areas to date. And one of the greatest moments for me was recently going into Attend Anywhere, extracting the data around number of visits. And what's really interesting to see when I pull that into an SPC chart is that you can clearly see where we reintroduce face-to-face visiting, and it completely dips down in terms of number of visits. But what's fascinating is when we reintroduce some restrictions, I think it was back in September of this year because of the third wave, it shot back up again. And now for me, I didn't go around saying, don't forget, you've got these devices, don't forget you can use it. And it was something the staff just picked up and started using themselves. So for me, that demonstrates some sustainability, I think, in terms, but I'm very aware of what's driving that, and the motivation behind that is the fact that these poor patients are sat in beds and they're not able to see their loved ones. So there's that, Cotter talks about creating that sense of urgency. That sense of urgency is there, isn't it? Which is a key, kind of a key driver for that. And one of the other things I think about in terms of as we've spread it, again, I think that key motivator has been this. We've not really had any challenges in terms of, apart from some local cultural idiosyncrasies, you get. But if we didn't have that, I think it might be more difficult to spread. And if I think then conversely about some work we were doing on falls, and we were trying to spread that work, and that was a lot harder in terms of spread and also in terms of sustainability. And I recall somebody saying to me, talking to me one time about Rossi's iron law, and the way in which it was explained to me was this kind of depreciation of the quality of a project when that sense of urgency or that experience of what motivated that improvement project in the first place gets lost when you pick it up and you put it elsewhere, when you try and spread it elsewhere. So what we've tried to do to counteract that is take the person, or at least one of the key leaders from the original project, along to kind of influence the next step in the project and the next step of the project. So it's a bit like, I don't know if people are old enough on the call to remember when you used to record the top 40 on a Sunday on your tape. Yeah. And your friend might have forgotten to record it. You're like, oh, borrow mine. And then they take a copy of that recording, and the sound recording gets worse and worse over time because it's kind of repeated, and so the quality reduces. So that's my understanding of Rossi's iron law. But also then I was thinking about, if we think about a more broader, it's not an improvement project per se, but it's the wearing of masks. And if we think about the sustainability and the spread of wearing masks, and I think people are now getting some of that kind of, they're getting complacent about it now, aren't they? So there's something around sustainability and how long is that expected to last? Does that make sense? Yeah.
So I think for people on the call today, I'm sure there's a kind of something there to take heart from, in terms of, you were saying that the project you were involved in started kind of with one ward, because in terms of the collaborative, each of the organisations that have put forward, that put themselves forward to be part of the collaborative, have got a couple of wards. And I certainly can see there's a couple of people on the call today that I know work in some quite big acute hospitals, and I think one of the challenges is kind of how do you get this how do you get things spread across such a big organisation? But I think in terms of sustainability, I think one of the challenges is how do we get things to become business as usual? I think that's a real challenge. So I think it's really interesting. I think you know your point you made around almost that burning platform, the sense of urgency, you know, is quite an important one. Thinking about you know, sort of thinking about our audience listening today, if you were to give them some sort of top tips on some of the key success factors in terms of spread and sustainability, what would be, say, a couple of sort of top tips that you give people on the call today?
So I am a nurse, as you know, so I am a nurse. I'm a clinician by background, and I always recall when I was training as a nurse, one of the things they used to say to us is you should be considering discharge on admission. And I think you can apply the same thinking almost to improvement. You should be considering sustainability of your project or your improvement work at the outset, because that way you can build things in at every step of that, and you should be looking at things through a sustainability lens as you progress through the project. But I think in terms of some specific things, I think understanding the context of where you're doing the improvement work and thinking about moving that elsewhere as well is thinking about the context. Improvement is both relational and contextual, I think, because again, you will have those idiosyncrasies in terms of culture. And so even where you may have 10 medical wards, or, you know, so they all got the same sort of patient profile or whatever else, it all comes down to people, and we're curious creatures, aren't we? We can be very different. So, and again, it's about building the right team, so doing some of that work around who are your stakeholders. And I assume at this point you've gone through some of these steps around, you know, who are the stakeholders in this? And going back to the virtual visiting team, one of the stakeholders I hadn't considered, because I thought I'd included our information technology department. Who I hadn't included, though, was our chief nursing informatics officer. And I hadn't considered him really, and I don't really know why. And it was an opportunistic, always take your those opportunistic encounters are usually the best ones, aren't they? It was an opportunistic encounter with him about something else, and I was talking to him about virtual visiting, and he was like, well, I'm really involved in the Attend Anywhere platform in a different way. And so he already had those relationships with our IT department and some of the other departments like procurement around getting the devices and the hardware. And honestly, I can't thank him enough, because the minute I engaged him, the project really took off. It was really surprising. So just really think about who are your team, and think about the most unlikely of people and the most unlikely stakeholders in the most unlikely of places. And so think about, again, that system around who hands work onto you and who do you hand work off to, and you know, what are some of the impacts there. And there's something really as well, as you're going through, you need to use measurement, as we know. So it's about building that system of not only quality assurance, but quality control. So about evaluating the performance of your improvement work as you're going, you know, during operation. So as you're going along, not waiting until the end. And then that's that whole thing around sustainability as you go, as opposed to waiting and thinking about it as something you do at the end of an improvement project. And, you know, comparing your performance against your goals that you set at the outset of your project. So that helps you to identify problems early on, and then be able to escalate those problems quite early on as well, and overcome some of those kind of age-old problems that we get when it comes to sustainability. And I think having a robust evaluation as well for your innovation or your improvement will help provide valuable insights into the factors that have made it a success, and that will help in terms of not just sustainability. I can't say that word. I think we need a different word. Yeah. Something that's easier to say, but also in terms of a spread as well, because if you can isolate what were those kind of unique things around that we can pick up and we can put elsewhere, but whilst wrapping those idiosyncrasies in terms of a different area around it. Because my experience often is you get this like these improvement islands, don't you, and they kind of work well where they work, because we don't really consider the fact that you actually can't just take something from one area with a certain team, certain leadership style and all those things, and then put it elsewhere. So it is quite complex, because when you bring people into anything, it does make it more complicated, doesn't it? But again, engage your people very early on, and engage them at every step as well. Listen to them, give them a voice, make them feel valued, and give them an opportunity to participate and contribute, I think. So yeah, I think those would be some of my. But the other thing, I think, I go back to that whole, how long is sustained? And I always remember, and I can't attribute the quote, I'm afraid, but I always remember reading something that's kind of stuck with me, and it's, do we ever really want true sustained change? Because today's sustained, put my teeth in, change becomes tomorrow's resistance to change, because there's almost then this expectation that, well, we've done that, we've got to where you said we needed to get to, why are you asking us to look at it again? And as we all know, we work in, the systems and processes that we work in are dynamic. They're like shifting sands of time, aren't they? They're always, everything's always shifting, whether that's about resource, time, whatever. So there is something about like sustainability, or something that's okay for now until we need to look at it again. And that's where that kind of evaluation and that quality control and that performance can kind of build in that in, can help. Does that make sense?
No, it does, and I think that probably leads nicely into sort of the next question, really, because you sort of touched on something there in terms of sort of complexity and the kind of human element of change. What would you see as some of, you sort of talked about that, but what else would you see as maybe some of the sort of key challenges to spread and sustainability?
So I think people can actually be hugely challenging to sustaining and spreading improvement, but and communication can be a big challenge, because I think the key thing for sustainability is about raising awareness within the team, and everybody having the same level of understanding and information about the project and where the project is heading, and what's, managing expectations. And there's something that I recall as a part of, it was the productive ward, I think you called it in England, but obviously in Wales we're not allowed to use anything that you English people, we have to use our own terminology. So it's called Releasing Time to Care, Transforming Care in Wales. And one of the things I remember being introduced to was the 7 spreadly sins. Whilst I appreciate they're hugely around spreading, I think they're quite applicable to sustainability as well. So, and I can't remember them off the top of my head, so I've got them up on a screen, because I'm not that clever, so I am human. So it's about creating reliable processes, isn't it? And I think before you can start to spread and indeed to have that sustainability, and that comes down to your tests of change. And I think it was Dr. Shah from ELFT who said we shouldn't be rolling out the red carpet, we should just be rolling out these tests of change. And it's it's an incremental iterative process, isn't it? And that no one test of change is going to lead you to a point of sustainability. And I guess again it's building in those expectations and managing people's expectations of what that looks like and what's expected for them through the journey as well. Because at any point, if they feel, and particularly at the moment, I think is hugely challenging, isn't it? Especially for our staff who are working clinically, they are up against it day in, day out, and actually getting them engaged in any sort of improvement work, I find at the moment is hugely challenging because they see it as an additional thing. And I think that going back to that thing you say, Vince, about being business as usual, I think that's a cultural change that takes a long time. And if you look at EFT's journey, for example, they've been working very closely with the IHI. I think they've been on their journey for 10 years or more, and I don't want that to sound, take some comfort from the fact that it can be done, but it's not necessarily something that happens overnight. And we've got a lovely saying in Welsh, and it's called double dog garag garag. And what it means is you keep tapping on that stone. So if you keep tapping on the stone, so it's something about resilience, something about tenacity, and keep on keeping on, keep pushing, keep sharing the vision, keep communicating, keep engaging with people, and eventually kind of you'll get to that point of where you want to get to. And one of the other key things I think that tends to happen and is challenging in terms of sustainability, it all gets hung on one person, and then when that one person moves on, or unfortunately becomes unwell, or anything else, then it all kind of falls apart. But yeah, the 7 spready sins are definitely something I try and keep at the forefront of my mind when I'm looking at building sustainability. I won't go through them all because it's easy enough to go off and actually you could just check out my tweet from this morning. I shared a lovely visual of the 7 spready sins. But so yeah, and so I guess for me, I think my biggest tip is open, honest, candid communication. If you're not open and honest about what's happening and where you need to go and what needs to be done, then people are left up to with their own mental models of what's happening, what's expected of them, and that's where misinterpretation and confusion can happen and things can go away.
Yeah, that's really interesting, and I think you're right. I think the complexity and the pressures of just day to day, doing the job, can very often mean that you're kind of almost hitting up against a kind of brick wall a lot of the time, and somebody who's an improver, I think it really resonates with me, that sort of, like you say, keep on keeping on, just keep going, because it's not always easy.
No.
So just I mean,
being an improvement advisor or being in an improvement role can be actually quite a lonely place sometimes. It can be like you're trying to, sail the 7 seas, in amongst storm and wind, or whatever it is called. It's just, and you're trying to look for those. But I think one of the key things for me around is find your tribe, find the right people, and make sure that you're addressing the right problem as well. I think is hugely important.
No, I'd agree with that, and I think certainly some of my ECIST colleagues on the call probably definitely agree that sometimes being an improver can be a lonely place.
Yeah.
You touched on it earlier when you answered one of the other questions about stakeholders. How important do you see the support for senior leaders within the organisation in terms of spread and sustainability? How important do you see that?
To be honest, I think it's hugely important because they are usually the purse string holders. They are usually the those who can give permissions. They are the ones with the authority often. So there's this. So recently, I've been exploring more around this relationship around kind of power and how. And one of the kind of descriptors around it was you have power when you have the resource and the authority to do something with those resources. But often what happens is you may have the authority to do something but not have the resources, and vice versa. So in terms of senior leaders, I think that they're hugely important because I think they can provide some practical direction, and they should be providing support, some visible support for frontline managers, and then some demonstrable commitment. So no rhetorical assurance, yes, we're behind this. They need, when things go awry, they need to be there and demonstrating that they are committed to this piece of work and helping you to overcome any of those kind of stumbling blocks, whether that's unlocking finances, finding a different way to do something. But often, I get this experience of rhetorical assurance that, oh yes, we're behind you, etc., etc. And when it hits a wall or something, then you're looking around and they're kind of not there to kind of support you. So there's something around health. I was thinking these questions have been hugely thought-provoking for me, so I thank you for that, because they have, and because I haven't really sat down and thought about sustainability, because it's kind of something you just kind of do on a day-to-day basis. So actually thinking about what it involves has been a great reflective process for me. But I think one of the things I experience in the health board that I work for is there's a spotlight, isn't there? There's a spotlight that comes from senior leaders, and sometimes that's a good spotlight, and sometimes that's not such a good spotlight. So there could be a spotlight in terms of reward and recognition, and this area is doing fantastically well, or there's a spotlight, you're doing really badly, you need to do something very differently. But that spotlight moves so much around, you know, back and forth. This is our priority. Oh, hang on, no, this has gone wrong over here, so this needs to be our priority now. And sometimes I really think the staff don't know, you know, where they're coming, going, been or gone, as we like to say in, you know, we'll be there now in a minute, as we like to say in Wales. So I think, you know, having a clear vision and communicating that vision regularly, maintaining staff engagement, inviting them to participate, really listening. So listening with fascination and acting on what staff are telling them. And again, it's about that demonstrable commitment, that demonstrable, you know, demonstrating that they are actually behind you, and they do actually want to get involved in this. And so some examples of poor kind of leadership have been when, you know, CEOs come down to the wards and they're like, please tell me, what's one thing I can do for you today that's going to make your life better? And it could be something very, very simple. Yes, I'll do something about that. Go away. And of course, you know, they then get pulled into something else, they forget, or whatever happens. And the staff never see that demonstrable element of commitment in that. And then all they'll remember is, oh, well, I remember the CEO. And sometimes with sustainability, the challenge is that organisational memory about how it's gone badly wrong before. So you really need to find a way to demonstrate to staff that it's different this time. We mean it this time. It is different. We promise it's different, and this is why it's different, because, you know, we're going to live our values. We're going to behave in the way that we say we're going to behave, and we're going to be congruent, and we're going to be authentic, and we're not going to you know, it's not going to be rhetorical. You know, we actually do mean this. So, so as you can see, I feel quite passionate about that, because I think sometimes that incongruence between what leaders say and what they do is hugely confusing for staff, and actually it's quite off-putting and disengages staff from any kind of want or motivation to want to get involved in doing something differently. And it's easier to say, actually, this is the way we've always done it, so it's safer for us to keep doing it in this way.
Yeah, that's really interesting. I think the authenticity of senior leaders is really important, and I'm sure there's many people on the call today that will recognise that sort of shifting spotlight as well. So final question really, and I think you sort of probably touched on this probably throughout all your answers, but the role culture plays in spreading sustainability, because we know it plays a huge part in sort of, you know, organisations. You know, it creeps into everything that organisations do, and I'm just kind of interested to sort of hear your thoughts on that in terms of spreading sustainability.
Yeah, to be honest, my view is that culture is the cornerstone of everything that we do, and impacts in both negatively and positively on anything and everything we do. And so from the outset of any improvement, you know, culture plays a huge part. So for example, if staff aren't ready, so there's something about assessing the readiness of a team or an organisation to engage in a piece of work, because it's hugely, and again, going back to us as improvement people and how lonely that can be sometimes, if you feel like you're flogging a dead horse, for want of a better word, because that kind of assessment of readiness and you know, that hasn't happened, and so you know you're constantly up against a team that are quite fragmented, that, you know, they're not engaged, they don't want to engage, There are little subcultures. You know, I've worked on wards where healthcare support workers have ruled the roost, you know, and there's these like little subcultures that can occur sometimes, especially if there's no strong leadership, and that, you know, those things aren't managed in a timely manner by the leader. So again, leadership is hugely important. So yeah, I think again it's about understanding the context in terms of where staff are in terms of their readiness, their will to want to, and often the will is there, and often the ideas are there, but we often fall down on the execution, and that's hugely, that can often be related to the way in which it's communicated, the way in which we move forward, and we don't engage the right people, we don't give staff that demonstrable commitment, and all the other stuff that I've talked about. So yeah, I think culture, and one thing in particular from a culture point of view is psychological safety. So psychological safety is something that I've been spending a lot of time looking into recently, and it's a project I'm doing for my Florence Nightingale Scholarship. And again, that's cornerstone for lots of things. It underpins a lot of what we do, because what it does is it generates that learning, high motivated team who are learning from what they do. I think we almost need to normalise failure and improvement as well, because the likelihood is you will fail at some point. The important thing is that you learn from that as a team, but also sharing that learning. And I think the other big thing in terms of culture is about how we build in a recognition and celebration. Even if they're small wins, they need to be celebrated, and staff need to be appropriately recognised for the work that they do. And if somebody comes up with an original idea, then that should be recognised and celebrated, and not carried off as something the organisation has kind of done. Again, you know, you will alienate staff, won't you, if they don't feel that they're being valued. So yeah, I think it's hugely important.
That's great. Thanks, Becky, and thanks for kind of giving you some time there to give us some really good comprehensive answers there. So we've got about sort of 25 minutes left. So what I'm going to do now is just to open up the conversation now to kind of colleagues on the call, to see if we've got some questions now. Everyone's had an opportunity to absorb those really good and comprehensive answers. So, if anyone's got any questions, do raise a hand, and I will try to look out for those. I see we've got quite a few of my ECIST colleagues on there that can probably identify with some of those things that you talked about there. Particularly, I think the resilience and the kind of need to keep on keeping on. So I'm not, without wanting to kind of pick on anyone, but I've got a really good colleague on the call here that's been doing a lot of work on the Modern Ward Round Collaborative with us, Wendy Rees. So I just wonder whether, Wendy, sorry to put you on the spot here, whether you kind of got any reflections on Becky's sort of answers.
Yeah, really great to listen to you, Becky. I really, oh, hold on. Sorry, a bit of an error there, wasn't it? Didn't even have my iPhones in. Really lovely to hear what you're saying, and what really comes across to me, Becky, is you're such a practical, sensible person, and I really like that. And hopefully, I think that I probably am similar. So I think some people get quite caught up in the sort of whole programme of improvement, and it actually can put some people off, can't it? Because you can get some quite high level programmes with lots of milestones and actions, and the people actually doing the improvement on the ground can feel a disconnect between sort of what's happening at board level and what's happening on the ground, and may feel a little bit disempowered by that, because actually it's quite can be a bit overpowering, can't it, at times? So I just wondered, how do you influence your senior team to be a little bit more sensible and practical in their approach to running a programme?
Yeah, I completely agree with that, Wendy. I think so for me, I've done a lot of reflecting lately around how actually, because if you take some of the improvement work that's happened as a result of COVID and the pandemic, it's just happened. All the barriers have been removed, so the purse strings have been loosened. Yeah. All those things that normally get in the way. If you throw the word COVID at it, you can get away with, well, murder. You can get away with anything, can't you? I think influencing, as long as, for me, in terms of where I work, it's the assurance part that's the important bit. And I think as long as you can cover off, again, it's about your messaging, isn't it? And knowing who your audience is. So if you're trying to influence senior people, you need to use language that they will understand and language that is going to provide them with that safety. So they need that level of psychological safety that by doing this, because I am hugely practical, but I can be a bit of a rebel. And so I am a bit of a disruptor, and because why should we stick with the status quo? Because it's obviously not working as it is, otherwise we wouldn't be looking to do something different. But what I've learned is, I've learned my messaging, I've learned to hone my messaging so that it lands in their language, if that makes sense. So Adam Grant has written a great book called Originals. And in the book, he talks about your messaging. And one of the examples he gives, he takes all of these like really senior people, puts them in a room and asks one of them to pick one well-known song. Say, for example, Twinkle, Twinkle, Little Star, Baa Baa Black Sheep, or Happy Birthday. And then he asks them to guess how many people in the room will be able to correctly guess the song that they are tapping on a table as a result. So all these kind of CEOs are like, well, about 80% of people are going to guess, aren't they? You know, everybody knows those songs, blah, blah, blah. So then they go ahead and they tap the song on the table. And actually a lot less, maybe 20% of people guess. And the reason behind that is the messaging and the project. What you've got to remember is you have poured your heart and soul into it. You know it inside out. So you've got to be able to communicate that song that you're singing constantly in your head, that you, as you're tapping, the tune is going along in your head, but what other people are hearing is just a lot of tapping on the table like Morse code, and they don't really know what it is that you're saying. The other great thing Adam Grant says in his book is that you need to use a Trojan horse sometimes. So you need to find that Trojan horse, that thing that, you know, like when you're trying to get kids to take a tablet or the dog to take a tablet, you put it in a nice bit of, you know, something sweet or some tuna or something for the dog. You need to find out what the Trojan horse is for your senior team in terms of getting your something a little bit different, but in the language that they're going to be more accepting of it. So that's what I try and do. It's not always successful, because ultimately what it comes down to is you also need to wrap that in some combo. So you need to wrap that in some safe quality assurance for those senior people, that they know that as a result they're not going to end up getting it from Welsh Government because you're starting to do something that's destabilising the system. Sometimes you have to destabilise it to get it to a point of performing better, don't you? So it's a balancing act, isn't it? And which is why sometimes it can be very, very lonely place as an improvement person. Does that answer your question?
Yeah, thanks very much, Becky. That's great.
That's okay.
Thanks, Wendy. Maria.
So I think mine sort of builds on Wendy, but it's slightly different. It's a statement rather than a question. So having been a transformation lead, I felt a pang when you talked about being a lone voice. Yes. So often you're absolutely right. It just seems you and a lot of paperwork trying to change the world. And particularly at the moment. So I think my thoughts are, how do we keep transformation going with the pressures of operations, which has always been challenging and now is more challenging than it's ever been, really, but more as important. And we've also seemed to have really quickly lost some of that transformation and the clearing of the decks that came with COVID, when change happened incredibly quickly.
I agree. We've almost reverted to type, haven't we? And I think that comes down to, I mean, I should have said at the outset, I'm no expert by any means. These is all my experience and my kind of like my perceptions. But no, I would agree. We've completely lost, and all of that control has kind of come back again, isn't it? Because I honestly think that COVID could be used as an excuse So for anything that felt a little bit uncomfortable, we say, well, we tried it because of COVID. And then everybody would be like, oh, well, that's okay. You know, COVID was like this huge currency, wasn't it, in terms of doing anything differently.
Absolutely.
To a point of, or trying to a point of performance, I think so we haven't got that now, have we? And I think we've reverted back into that safe. We need to be safe again. We need to provide that assurance. We need to provide. So I agree with you. And again, I go back to that whole, I think sometimes what COVID has demonstrated for me is that actually when we don't wrap a tight model around something, improvement can happen very organically, and that's almost where we're wanting to head to, isn't it? It's like we talk about it being business as usual, and that's what we actually experienced, I think, in some respects during COVID. But the minute we put back in those boundaries around assurance, those boundaries around using a certain model, those boundaries, it becomes tight, and people are like, ooh, you know, I don't want to do that anymore. Whereas when you remove those boundaries, or COVID removed those boundaries, I think it happened far more organically and far more naturally. So,
and I think organically from the shop floor upwards, because you didn't have managers with the experience. Actually, this was really a clinically led change, because actually the clinicians were, if anyone was, the experts on caring for those patients and the infection control elements, etc. So it was almost led from the bottom up rather than the dictated down, and all learning together, which is how it should be, but often doesn't feel like it.
Yeah, and I think, you know, and again, you know, the minute you talk about, I'm not a huge, measurement is my nemesis. I completely understand how important it is. I know that we need to do it, because how can we demonstrate the journey that we've been on and that we've reached the destination we need to reach and all that sort of stuff. But there are other people that are very good at that. So as long as I involve them as a part of that stakeholder world. But yeah, again, I think that's hugely off-putting. There's a lot of language as well, I think, that we use in the improvement word because of models and everything else that puts people off. And I think there are some blurring of lines as well between kind of the quality planning, quality assurance and quality improvement. And I think when that blurring occurs, sometimes people get, you know, a bit like, you know, like talk about IMTPs and things like that, and integrated medium-term plans and all those sorts of things, all that business language for clinicians. Hugely off-putting, I think.
Absolutely. Thank you.
Yeah. Thank you, Maria. Nice to meet you. Thanks,
Maria. Anyone else with any questions for Becky? So I've had a quick look in the chat box. I can't see anything in there. Just not really wanted to kind of pick on people, but I'm just looking at the sort of people on the call today. I had the sort of privilege a couple of weeks ago of going over to Leicester, because that's one of the sites that ECIST are currently working with, and it was to support some work outside of the sort of modern ward round collaborative, but we've got Victoria Demery on the call from Leicester, and it was great to kind of go over and meet Victoria, because I'd seen loads and loads of stuff on Twitter from her, and seen her on lots of these Teams calls. And as I was saying to someone the other day, it's great sometimes to be able to see people below their shoulders. And we had a sort of quite interesting conversation about, you know, sort of meeting people for the first time that you'd seen on Teams. But it was great to meet Victoria. So I can see she's on the call. So I know Victoria's involved in lots of different improvement projects over in Leicester. And I was just wondering, Victoria, so I hope I've given enough time in my ramblings for you to think of something to say. But just thinking about some of the challenges you've got there at Leicester, not necessarily just related to the modern ward round stuff, but also some of the work that we were over working with you a couple of weeks ago around the board rounds. And I was just wondering whether some of what Becky's been talking about this afternoon sort of resonates with you, and whether there's sort of you know, anything you'd sort of want to add to that, or feel that's going to be useful that you might want to sort of take forward from today.
Thanks ever so much. Hi guys. Yeah, I mean, as Vince says, I've been involved in quite a lot of improvement projects, and one of the ones we're working with at the moment is with ECIST around the board rounds. So a really great piece of work. I think, Becky, what you talked about today really did resonate with me, and I loved the Trojan horse analogy, in that actually, you know, I've got to think about what is it that's going to sell this piece of work. And in the safe space that this is, it's not necessarily selling it to the frontline staff, it's selling it to you know, the senior people who are incredibly busy. You know, operationally we are so constrained at the moment. They are pulled in 101 different directions, and actually this potentially is a small project with 5 wards compared to an ED that is bursting at the seams, and beds that need to be made available on the medical board. So I guess it's about the thing we're struggling with is getting that sort of high level support for this. And when I talk about support, I mean sort of practical support, you know, freeing up senior managers to go onto the ward to actually observe the board rounds, actually, you know, doing like exactly what you say, you know, you said, we did, that kind of stuff. Because, you know, being a clinical nurse by background, I know exactly what it feels like when someone comes down and on the ward and says, you know, what are we doing? What can I do to help you? And you think, oh my gosh, you know, they've made the time of day to come down and see us. And then they take your problem away with them and never fix it because they get sucked into something else, exactly like you said, Becky. So I think it's been really interesting listening to this sort of webinar around how to get that senior support. And actually, it's not about the, you know, we do have an SRO, we do have senior leaders attached to the project, but actually they are so busy. And I wonder whether there is something we can do around sort of pulling them in without overloading them, because I think we've got to appreciate these senior leaders are absolutely fatigued. You know, their cognitive load is huge at the moment. And actually it's about balancing that, isn't it? And seeing how we can pull them in so it's not detrimental to their workload and their well-being as well.
Yeah, I mean, you make some great points there, Victoria. To be honest, I agree with you wholeheartedly. I think one of the changing points for me, I think, is when I moved out of a clinical role into a more corporate role, it's a broader sense of what happened in those corporate roles. And I think sometimes the clinical staff, and quite understandably so, are within their little bubble, you know, what's happening in their world, and aren't necessarily they have not necessarily got that breadth of understanding around the different roles in the organisation. And maybe, I don't know, again, comes back to that authenticity. And but senior leaders need to be able to feel safe to say to staff, I will do my best to do this, and not overpromise almost, isn't it? Because there's almost this kind of expectation that somebody in a senior post in the organisation can do anything, you know, like they've got some magic wand, but ultimately they still got some constraints, no matter how, even as, you know, as the CEO, you know, that we're governed by Welsh Government, you know, so there's always a restriction somewhere that will prevent somebody from being able to do something. And I think it is just about being able to have those honest, open, candid conversations with staff and not overpromise sometimes, I think, because I think sometimes because the senior leader just thinks, I've got to make them feel better, so I'm going to say I'm going to help. They don't always necessarily understand that actually by not following through on what they're doing is more damaging than being honest and saying it's better. Staff will be far more receptive to that honesty rather than promises that don't get kept. Does that make sense?
No, it absolutely does do. And I think one of the things is actually our senior leadership team often are the ones that sign our clinical teams up to these programs of improvement, you know, that they see an issue, that they see the improvement program as a way to try and resolve that issue. They sign the organisation up to it, and then the clinical teams, yes, they buy into it, but they're not at that initial making the decision. The decision has been made to them. And we always talk in quality improvement, don't we, about making sure it's an organic process, like you talked about earlier, Becky, and that it isn't a top down being done to them, because as soon as people feel that things are being done to them, you get resistance. And I think, you know, for certainly some of the projects we're working on at the moment, they're a must do, because, you know, we've got lots of issues around capacity and flow, and this is one of the ways that we can try and fix this and make the solutions better. But actually the decisions were made at that senior level rather than at the ward level. So you're kind of on the back foot before you start. And then I think when you don't see those senior leaders necessarily on that shop floor with them, trying to articulate that can be quite challenging as a QI person. I sometimes feel like I'm the messenger in between, and I'm trying to be a politician and a journalist and keep everybody happy all of the time.
Yeah, I feel your pain there, Victoria. I feel your pain. It is a hugely difficult position to be in, because you are kind of like, you know, you're the messenger of, you know, Hades, the god of the underworld or something sometimes, I think, doesn't it? Feels like that. But yeah, messaging is hugely important. Communication is hugely important, but it's predicated on honesty and openness. And I don't know that you know, and again, that psychological safety, people need to have that sense of belief that it's okay to take those interpersonal risks in terms of being honest and candid about the way things really are, without kind of fear of retribution or blame or any of that.
And I think there's definitely something about when you start off on an improvement journey to understand what level of support you're going to get and how that's going to be communicated, because that communication is really key. So obviously Vince spoke about my Twitter. I'm only really recently new to Twitter, but it's a really good way of promoting the work that we're doing, tagging in key people who will then, you know, comment on it, you know. And actually, even if those key people can't get down to the ward level, just by commenting, you know, congratulating them on Twitter, it's a very public way of showing support, and it actually goes a hell of a long way. But I think understanding what your communication strategy will be at the beginning of an improvement program is really important, because that's the backbone of how you're going to share those successes and share that learning as well.
Yeah, no, I agree. And I'm a huge tweeterer. I love the connections and the networking and the knowledge and everything that's available on Twitter is just phenomenal. So I agree with you. Yeah, it's a great platform for sharing, particularly in the QI Twitter sphere, whatever it's called. Oh, Vince, you're on mute.
That's because I let out a huge sneeze, and I didn't want the rest of the world to hear it. So thanks, Victoria. Sorry to put you on the spot around that. Maria, your hand's still up. I don't know whether that's a legacy hand.
Yes, it is. Apologies, I'll put it down.
No, that's fine.
Legacy hand. It's great language, isn't it?
Yeah, I think we kind of moved on from, is that an old hand? So that's so I don't know whether I can't see anything else in the chat box, and I don't see any more hands up. So I don't know whether there's any more questions for Becky. So I shall take that as a no, and we've got a few minutes left, so kind of always good to give people back the gift of time, I think. But I've certainly found this afternoon's conversation really interesting. I think for me, there's some really key points there, from thinking about spread and sustainability right from the outset, and you know, not just sort of thinking, oh, we're getting towards the end of the project, what are we going to do about sort of maintaining it and kind of spreading that out. So I think that's a really important point. I definitely like the bit about being able to tap out a tune. I think it's probably a sort of bit of an alternative to your elevator pitch. I quite like that you know, we all live and breathe sometimes. I kind of and get very passionate about the work we're involved in, and I think, you know, being able to sort of communicate that to an audience, and a very varied audience. I think, you know, sometimes, you know, I think we forget the breadth of the audience we're trying to communicate the message to. You know, we need to probably tell our story in a different way and use different language, different line staff, as opposed to if we were sitting in the boardroom. So I think there's definitely something there that sort of resonated with me, and something I'll be using in the future. And I think the really sort of important stuff, and it seemed to kind of obviously resonate with people, was around culture, around psychological safety, and around the authenticity of senior leaders. You know, and I think just from sort of our everyday work, you know, our business as usual within ECIST, you know, sometimes it is a challenge. You know, we're all seasoned improvers, and I think Victoria made a good point about, you know, senior leaders will very often sign their organisation up to something like improvement, and you know, we see this from an ECIST perspective, that very often senior leaders within an organisation have reached out for our support, and then sometimes it then becomes a challenge almost then to kind of say, well, you know, hang on a minute, guys, you know, we kind of need your support here. We need you to be visible, and you know, I think sort of you know, I kind of can feel the pain of some of the people on the call when they're sort of running projects within their organisation and don't get the senior leaders involved. So I think definitely that stuff around culture, authenticity of senior leaders, and that kind of psychological safety has been really important. So hopefully, as we kind of move into the sort of the final stages of the Modern Ward Round Collaborative, and we've got an event in December the 16th, which is our sort of final event, although we're hoping to do something early in the new year as well. That as we're coming to the conclusion of this, I really hope that the conversation today has been, you know, been useful to those people running projects in terms of thinking about next steps and going forward. And most importantly, thank you so much for your time today, Becky. You know, there's been a bit of drama going on in the background about pulling this together, and Becky's been absolutely brilliant in sort of stepping forward to kind of participate today. And I think actually it has shown the importance of those networks and Twitter. So thanks ever so much, Becky. I owe you a huge favour, which I'm sure you'll call in at some point or other. So thanks very much, and thanks to everyone on the call this afternoon for your time. Enjoy the rest of your day, and hopefully we'll see a lot of you soon when we run the final event in December. So once again, big thanks, Becky. Thank you.
Thank you. Take care. Nice to meet you all.
Bye.
Bye.